I'm Evelyn McKnight. I'm an audiologist. I'm also the president of a patient advocacy foundation, Honor Reform. Yes, in 2000, I was diagnosed with breast cancer, went through chemotherapy. Unfortunately, I did have a recurrence in 2002. During that workup for the extensive treatment that I needed to have after that diagnosis, it was determined that I had hepatitis C. I had no risk factors. There was no reason why I should have hepatitis C. My husband, who is a family physician, was very concerned, alarmed, troubled by this, spent some time investigating, and ultimately called in the health department, and it was determined that 99 cancer patients contracted hepatitis C because of unsafe injection practices. The nurse reused a syringe to access a large 500cc saline bag. This was in Nebraska in 2000. So 99 of us contracted hepatitis C, a potentially fatal disease, while we were, working so hard to overcome cancer. Unfortunately, the Nebraska outbreak is not an isolated incident, and in the past 10, 12 years there have been more than 40 such outbreaks recorded in the literature. The CDC has tracked this and kept records of this, and they all stem from reuse of syringes or other medical equipment intended for one-time use. As many as 150,000 Americans in the past 10, 12 years received a letter from their state health department saying, "Dear sir or madam, you have been potentially exposed to HIV, hepatitis C, and hepatitis B through medical care by your physician or at the hospital, and you need to go in and be tested for those bloodborne pathogens." One of the most recent notable, all of them were notable, but one that really gathered a lot of publicity was the Nevada outbreak, in which 63,000 patients received that kind of letter because healthcare professionals reused syringes at a gastroenterology during colonoscopies, and of those 63,000, we think 115 contracted hepatitis C from that practice.